El Camino Health started its perinatal journey in 2008 with the launch of the MOMS program. After that, we realized that mothers needed highly specialized care in an acute psychiatry setting. We did a pilot in collaboration with other perinatal units. And after a great deal of work and collaboration, we launched our own perinatal unit in 2020. It is one of its kind in the country with the most robust treatment planning to address both the mother's needs as well as the needs of the baby. In addition, we have probably the most robust discharge planning anywhere in the United States.
At El Camino Health, it is a priority that we destigmatize mental health conditions. And so right from the very first prenatal visit, we look at a pregnant woman, her mind, her body, her pregnancy, as one continuous patient. And together with social workers, mental health providers, obstetricians, our nurses, we do a wonderful job of really supporting our patients completely, mind and body together.
We started the program in response to an unmet need in the community, and we're the only one of its kind in this part of the country. Obviously, I advocate and support creation of more and more programs, and I strongly urge providers to look us up and refer to us. Women need this level of care. This is life-changing care and can prevent adverse outcomes like suicide and infanticide and set them up for success after struggling with a severe mental health issue.
For many new parents who come to treatment in the MOMS program, they first come to treatment often feeling a sense of isolation. There's a lot of stigma around receiving treatment for their symptoms. Mental health is so important and critical in the perinatal period, not only for the health of the parent going through this, but also for the health of the child and the family system. It's so crucial to the well-being of both the individual and their family to be able to reach a point where they can heal from their mental health journey.
Some of the stressors new parents are facing include challenges financially, access to childcare, being able to spend time in a quality way as a family. The housing situation in our area has changed. And I think just in general, childcare, fear of illness after the pandemic has been impactful on how our families see the world and how they interact with each other.
Mental health care is really an important part, an integral part of perinatal care because 1 in 5 women experiences a mental health condition. And actually, the most common medical condition that affects a woman during pregnancy is anxiety and depression.
When we have folks enter treatment for the first time, we often see folks who are really struggling with their mental health symptoms. This is often reflected in a scale that we use called the Edinburgh Postnatal Depression Scale. Recently, we did a study to look at the level of improvement over time. And what we found from the point of a person entering treatment to graduation, there's been a 60% decrease in that scale from the time of admission to discharge. That number itself is critical. It means that the patient is able to take care of themselves, take care of their families, and to attach to their baby in a secure way.
I just felt sort of lost in my new identity becoming a mom. I had always sort of felt like I had been successful in my career and, academic life previously. And then I just as a mom, I just felt like a total failure. Like I couldn't breastfeed. I couldn't get my son to take a nap for more than 15 minutes at a time. I felt like I had lost my identity and didn't really know who I was.
Women who give birth need this help, particularly because mental health is so stigmatized. And so it's our job to make our patients, their families feel comfortable getting support. So right in the beginning of pregnancy, our patients are screened for any mental health conditions, and we talk about it with our patients throughout pregnancy and in the hospital.
El Camino Health has much to be proud of. For a community hospital, we offer the best perinatal psychiatry care anywhere in the country, which includes inpatient perinatal services, outpatient step-down, pre-access evaluation and screening, and assessment and screening of women as they go through the process of labor and delivery. For a small community hospital, this is a big achievement.
For anyone who's giving birth, especially here at El Camino Health, I would just say make sure that you're aware of all the resources available to you. They're just such wonderful support. Please don't be afraid to ask for help. You're not alone. There are so many other moms out there that have all different experiences giving birth, and El Camino Health will really take good care of you.
mental health treatment takes a village, and I think it requires us to understand the whole individual, who they are as a person, and what they need to thrive. I think it requires the support of the therapist, the psychiatrist, as well as the family. I think it really requires involvement of a whole team to help somebody move through their mental health journey.